Hi, I'm Dr. Randy Reed, and I want to talk to you just for a moment today on this episode of Spineline of something that's very, very important for all of us here in this new year. And that is that one thing we've become to realize, all of us as both doctors and as patients, is that the cost of health has shifted. The cost of being healthy is now shifted to the patient. The patient is now going to have to pay more. And the reason for that is because we have higher out-of-pocket expenses. We've now seen in 2017 that our deductibles have gone sky high. The co-pays have gone up. The allowable services for each insurance is dropping, meaning the number of things they cover. Like, for instance, they don't cover therapeutic exercise, or they don't cover electric stim, or they don't cover laser treatments. Dropping things out of care is saving the insurance company money and making you have to pay more. And we're having more and more plan limitations like visit limits. And again, going back to the services that are provided. In fact, the Kaiser Foundation found that since 2006, your out-of-pocket expenses have gone up so high that it's 255% higher for the insurance company to start to pay your immediate bill. So on your explanation of benefits, it's going to cost you a lot of money until they pay the first dollar because of all these deductibles, all the co-pays, and they're limiting the services. So for you, it's very, very important that you take care of your own health. Starting with this year, you're going to have to look very carefully at how you spend your health dollars. You're going to have to eat better. You're going to have to live better. You're going to have to do some things that are different to keep you out of these situations where you have high out-of-pocket costs. You're going to have to find somebody or someplace that gives you treatments or health treatments at lower cost but with higher effectiveness. And that's what chiropractic does, and that's why I wanted to talk to you today. There have been a few recent studies that have been put out recently, and I just want to read you. I hate to read to you too much, but I want you to understand how successful chiropractic is. The national guidelines made by the American Pain Society and the American College of Physicians in 1994, 2007, and again in 2014 say that spinal manipulation was cost-effective and had the highest effectiveness for subacute and chronic low back pain, as were other methods usually within the chiropractic scope. Things like rehab, exercise, and acupuncture, meaning all those things are cheaper with a chiropractor than they are in regular medical offices. It also found that there was no evidence at all of the cost-effectiveness of medicine for low back pain. So prescription things just really don't work either, and that costs a lot of money to insurance companies. Mercer, Mercer Health Benefits in 2009, in a report co-sponsored by Harvard Medical School, found that when considering effectiveness and cost together, chiropractic physician care for low back pain and neck pain is highly cost effective and represents a good value in comparison to medical physician care and to widely accepted cost effectiveness thresholds. Another study in Tennessee in Blue Cross and Blue Shield in 2010 said they found that the costs for chiropractic group were 40% lower than a medical group. Even after factoring in the severity of conditions like disc conditions, patients presented costs for initiating care with a DC rather than an MD were at 20% lower. They estimated in Tennessee that if all the people with low back pain had gone to chiropractors, it would have saved them $3.2 million in 2010. ACN and the United Healthcare Group found that when chiropractic services for back pain and neck pain are compared to medical services for these conditions in head-to-head competition on a level playing field, chiropractically consistent demonstrated superiority in effectiveness and cost effectiveness. Also, another one sponsored in 2007 by the United Healthcare Group concludes that the single most important factor in holding down costs is the profession of the doctor with whom care is initiated, meaning it depended on who you went to see first, how your cost was lowered. And again, now you're going to be paying those costs, not the insurance company. That's why I'm talking to you today. It's very important. To briefly sum up these findings, when care is initiated with a chiropractor, The severity adjusted total episode cost is lower than for care initiated with a primary care medical vision, and it's drastically lower than the care initiated with an orthopedic, PT, rehab physician, or other practitioner. So those are some of the things why I think it's important that you understand that chiropractic is at a lower cost, but with higher effectiveness. So you're going to get better use of the money you're going to have to spend, because the insurance companies are going to be like a car insurance now. Your health insurance is going to be like your car insurance. You pay it every month, but you're really not going to be able to use it until you have a catastrophic event. And then you're still going to have to pay with a higher deductible out of your pocket. So what do you do as a patient? Well, for us, we really believe in what we do here at this office. We think that preventative care is really, really important for you. So number one, we think you ought to get regular chiropractic adjustments. Prevention. It's been shown that getting adjusted on a regular basis keeps you free of problems and injury. Number two, get in here first when you have the first signs. When you have the first sign of pain or dysfunction, get in here. We found that people who use the maybe it'll go away statement, the 5 most dangerous words in chiropractic, maybe it'll go away, when they wait too long, it gets you messed up. And it makes your care be much longer and, again, much more higher for your out-of-pocket expenses. So get in here as soon as you can. I also want to tell you that from now on and every month, we are going to produce at least 1 and maybe 2 spine line videos like this that are going to show you how to keep your healthcare costs down by doing some things on your own. Eating right, exercises that'll help you, things like that. Important health tips for you so that you, through the spine line, this video presentation, will get information that you can help. And the last thing I want to tell you is that we are really sincere about you being as healthy as you can possibly be. You can ask us at any time for information, and it won't cost you. Please don't hesitate to call us and set up an appointment for a consultation if you have something that you're concerned about in your health care. Happy New Year, and I wish a healthy, happy year for you this year. Thanks.